Dr. Riscotra, what's your name and how would you like to be addressed?
I'm Renee Marshall. Please call me Miss Marshall.
Okay, Miss Marshall. The nurses tell me you're not feeling very well.
Yeah, I will feel worse now than when I got here.
Okay. I was just reading your chart from when you arrived. Looks like they did some blood tests and some imaging tests last night and diagnosed you with pneumonia, but it was fever and cough that brought you in?
Yeah, for the past week I've been feeling pretty sick at home.
Okay. And so just to be clear, you feel worse now in terms of your shortness of breath compared to when you were at home?
Yeah, I'm pretty sure.
Okay. Looks like they had ordered some antibiotics and some fluids and some fever medicine for you. Did any of that make you feel any better?
A little bit. I think I was a little dehydrated after the fluids. I started feeling a little bit better, but now I have more shortness of breath than when I got here.
When did the shortness of breath worsen?
Maybe 20 minutes ago. It started pretty suddenly when my breathing got worse.
Okay. Do you have any chest pain with that?
No, doctor. It's mostly my breathing.
Okay. I'm worried about your breathing. I just want to collect a little bit more information. Do you have any weakness in your arms or your legs?
No, I'm just tired and I'm worried about my breathing.
Okay. Yeah, I'm worried about your breathing too. Do you feel lightheaded or dizzy at all?
I feel a little lightheaded.
Okay.
I feel dizzy when I sit up.
And when you mean dizzy, do you feel like the room is spinning, or you feel more like you're floating away?
No, nothing's spinning. I feel mostly like I'm floating.
Okay. Do you feel nauseated or like you're gonna throw up?
No, doctor.
Okay. Looks like you were having some itchiness when I came in. Tell me more about that.
Yeah, I feel itchy all over my whole body. Feels like I might be getting a rash.
Oh no, okay. I want to check out that rash. Sorry, real quick, do you have any other medical problems?
So my doctor treats me for diabetes, high blood pressure, and high cholesterol.
Okay, and then just to be clear, there's no chest pain with the shortness of breath?
No, doctor.
Okay, with all those other medical problems that you have, I do want to get an EKG just to make sure your heart's okay. And then because the shortness of breath got worse all of a sudden, I am going to repeat a chest x-ray. I know they already got one, but I just want to make sure nothing has changed since the shortness of breath got bad all of a sudden.
So the nurse came in and did an EKG before you got here, and she put it in that folder on the counter.
Okay, I'm just going to go take a quick look at that, okay?
Okay.
Well, this EKG, I'm not seeing any signs of a heart attack. I'm not seeing anything that looks terribly dangerous. Your heart rate is a little fast, but otherwise it looks pretty good. Is it okay if I do a physical exam on you?
Sure. What do you want to check out?
Well, you said you were having a rash, so I wanted to take a look at that. And then with the shortness of breath, I want to take a listen to your heart and your lungs.
Okay.
Oh, thank you. I'm just going to review. I see that there's no swelling in your airway. That's good. Your heart's going a little fast. We talked about that. On your lung exam, I can hear the pneumonia that they diagnosed you with yesterday, but I'm not hearing any wheezing. And then based on this rash description and picture, Well, it looks like you've got hives. Did anything bring on the shortness of breath?
I'm not really sure. It started after the nurse gave me antibiotics.
Oh, okay. I'm just gonna check your allergies here. Miss Marshall, do you remember if you have any allergies?
I had a really bad reaction to penicillin when I was a teenager. They said I could never have anything like that again.
Do you remember if you had to stay in the hospital when you had that allergic reaction?
I'm pretty sure I had to stay there for at least a week.
Did they have to do any special tests or interventions? Do you remember?
I'm not really sure. I know I had to stay in the ICU and I had to be on a breathing machine.
Okay, I'm just going to see what antibiotics they gave you for this pneumonia.
What is going on?
Well, I'm worried that you're having an allergic reaction.
Oh, what do you mean? What's causing this? The other doctor said it was pneumonia.
So you definitely do have pneumonia, but the antibiotic that we gave you to treat the pneumonia is very similar to the medication you got when you were a teenager. And so I think that the shortness of breath that started and with the hives as well, that you're having an allergic reaction, and that's why you're feeling much worse.
Seriously? So why would they do that? I let them know I was allergic to penicillin when I came in here.
Yeah, I'm not really sure what happened.
Okay, so am I gonna need a breathing machine? Because I really don't want that.
Based on what I'm seeing on what I'm hearing on your lung exam and your oxygen levels, I don't think you're going to need a breathing machine just yet.
Okay, so how does that happen in a hospital? Whose fault is this?
Well, the team last night was giving you antibiotics to treat your pneumonia. I'm not really sure exactly whose fault it was, but there are systems in place that are supposed to prevent a mistake like this from happening, but obviously something didn't go right.
Yeah, it sounds like a pretty big mistake, so how can I make sure this doesn't happen to me again?
Yeah, I hear your frustration. I'm really sorry that it happened. I am going to talk to my nurse manager and then also my medical director so that they can investigate as to why this happened, and make sure that it doesn't happen again.
Okay, so is there something you can do to treat me?
Yes, I'm going to give you some medications to help with the shortness of breath and the hives.
Okay, I hope the medicines work.
Yeah, they should work. We're going to give you some antihistamines and some steroids. It'll go straight through your IV. If you don't get any better, I may end up having to give you some epinephrine.
Okay, so what happens to me next?
So I do want to make sure that the medications work and that you don't get worse. So I will be watching you in the emergency department for a little bit before we work on getting you a bed upstairs.
So I'm going to be stuck down here in the emergency department even longer?
For a little while, yes. I just want to make sure that you're safe before you leave the emergency department, and so I want to make sure those medications work. But I'll call the inpatient team and just make sure that they know exactly what happened and what treatments and interventions that we did, and I'll do my best to expedite a bed for you.
Please, I really just don't want to be in the ED anymore.
I understand, and I'm sorry that this happened, Miss Marshall.
Thank you for seeing me, doctor.
You're welcome. Did you have any other questions or concerns?
I don't think so.
Okay. All right. Well, let's hope get you feeling better, okay?
Okay.